When we talk about metrics, there's a lot to talk about. People are really familiar with some metrics. So for example, accuracy, the total number that's correct over the total number that you predicted. But we know that using this number is not always a good way to evaluate models, and especially not alone. For instance, if you can imagine a system that has 100 service lines and only 15 of them are lead, if you came up with a model that said that 0 are lead, then you would have 85% accuracy, which is pretty good. But you've actually not found any lead and not added any value. So there's other metrics that people may actually be familiar with in other contexts of their lives, like in health and medicine. So for instance, the positive predictive value, if you've ever had like a screening test done, and the doctor has said you're at a high risk for a certain issue, they likely also told you the positive predictive value, which estimates out of all the people that have this high risk result on the test, how many of them actually turn out to have the issue that you're screening for. So this is a really important metric within healthcare, and it's a metric that we use also with lead service lines. So the positive predictive value in our context is of the lines that we predict are lead, how many of them actually turn up to be lead. And this metric is also known as precision, and it's one of the many metrics that we talk to customers about when we're setting a threshold to separate those unknowns to that higher lead threshold.